What if a hospital suddenly closed its doors and walked away from everything?
Well, that's essentially what happened at the Eastern Ozarks Regional Health System. One day, it was fully operational, and the next morning, employees showed up to work to find the doors locked. When hospitals shut down, and sadly, it does happen, what happens to everything inside? Over the last decade, particularly in rural areas, over 100 hospitals in the U.S. have had to close their doors. While most of the time the equipment, medications, files, and other objects are cleared out responsibly, there are cases where your information is left behind for anyone to see.
That was the case in Cherokee Village, Arkansas at the Eastern Ozarks Regional Health System.
And it even led to a big lawsuit by the Arkansas Attorney General.
So I wanted to find out why this happened and what the results were.
Join me as I take a deep dive into the hospital that was abandoned into a preserved pocket of time. By all accounts, Eastern Ozark Regional was quite the successful hospital. In fact, many of its doctors were adamant about its patients' health and safety. One Dr. Jackson said, "Practicing medicine isn't just a science, it's an art. The art of taking care of human beings. Sometimes, it's gotta be about the patients and not the money." It was known by most as the Baptist Memorial Eastern Ozarks Hospital in its first 16 years of operation, until it changed its name and ownership in 1995 to Eastern Ozark Regional Medical Health System. Unfortunately, that's when things started to go downhill. According to one former employee that wished to stay anonymous, it was when the ownership change occurred that things took a turn for the worse. I worked at this hospital from the day it opened until 1995 when new management took over. It was downhill from there. It used to be a thriving facility with lots of things going for it. Unfortunately, due to poor management decisions and inadequate support systems, it went on a downward spiral into self-destruction. Such a shame too, because the community really needed a hospital close by. The doors shut in 2004, but it was almost as if no one knew. Employees even showed up to work the next morning and couldn't get in the doors. Equipment was left behind. Rooms looked like they were ready to accept patients. Lights still worked in the specialty building. Bedpans were still wrapped in plastic, and branded mugs were waiting for patients to take them home. It was an untouched relic. But what really troubled me, and many others, was the fact that patients' files were left behind as well. This may not seem particularly frightening until you really sit and think about what that truly means.
I mean, the door is open in the front, so anything could happen.
A patient's file has everything on it. Names, addresses, financial information, social security numbers. Anyone could walk into that building, pick up a file, and walk away with somebody else's identity.
This is 1966, this record.
So why did the hospital close in the first place? And why did they leave everything behind?
Well, different accounts tell a few different stories.
The director of nursing, Val West, said the hospital was forced to close because of problems with the hospital's lab. Dr. George Jackson said the lab closed because of a chronic lack of reagents, equipment used to perform blood tests on patients. Dr. Francis Duke said that the reagents were expensive and the hospital wasn't ordering enough of them. Eddie Deese, the owner of Correct Care, stated that Eastern Ozarks was significantly behind on its payments and owed them a tremendous amount of money.
So it definitely seemed like it was multiple factors all going on at the same time, and all of it boiled down to money.
That still doesn't answer why everything was left behind, including the patient files. For nearly 2 decades, the hospital sat abandoned, quietly eroding and sustaining slow damage from the moisture in a humid environment. But everything inside remained.
The search of an abandoned hospital in Cherokee Village, led by the Arkansas Attorney General Leslie Rutledge, to thousands of patient and employee records being found. The Attorney General filed a lawsuit in Sharp County against the former Eastern Ozarks Regional Health System, alleging violations.
Copies of Social Security cards, driver's license, and medical tests were likely rummaged through by trespassers. And the unsettling fact is that we may never know how many former patients had their sensitive data exposed and potentially stolen.
This is a HIPAA violation. These people might still be alive.
According to the lawsuit, the investigation uncovered no evidence to suggest the hospital took any reasonable measures to permanently destroy or secure those sensitive files. In December of 2022, Attorney General Rutledge announced a $77,000 settlement with the owners of Country Medical Services of Arkansas, Inc. This was the parent company of Eastern Ozarks Hospital in Cherokee Village. The owners would have faced civil penalties up to $10,000 for each violation of PIPA and ADTPA. So now we know why the doors were forced shut. Likely from lack of funds, and that owners were held accountable for leaving everything behind. But we still don't know why it was left in the first place, and unfortunately, we may never know.
But what we do know is that this isn't the only abandoned building to leave everything behind when it closed.
There are cases all across America, just like this one, that still haven't been brought to light.
Medical identity theft, which is on the rise, and tonight a state senator agrees what we found inside this vacant building is wrong.
And I, for one, think this is a problem that needs to be solved when medical facilities first shut down. If nothing else is done, those sensitive files need to be dealt with to make sure that they don't end up in the wrong hands. Just because a building is abandoned doesn't mean it's the end of its story.